Hello budding gynecologist, welcome to my first video on decoding OBGY residency. As the batch of 2022 will be having exams this year 2025, so I will answer a list of important queries which you all must have in mind. So let us discuss about obstetrics and gynecology post-graduation exam batch for the 2022. So this is a list of queries which you all have. First one is the eligibility criteria for the exam. What are the things which you should have done before appearing for the exam? Next, timing of the exam. When the exam will be held? Okay, you all must have in mind that my exam will be this year or in January or in October or November or this summer. So we will clear and discuss these questions also. Then theory and practical. What are the question sets of questions in theory and practical? Then from where to study? Okay, yes, this is the very important question which all you must have. Where to study, from where I should study, what are the books which I should follow. Okay, then study plan, a proper plan for the study, a proper study plan for you which will be very helpful for completing your syllabus. First is the eligibility criteria. So in the eligibility criteria, you must have cleared the BCBR exam, which is basic course in biomedical research. Next, you must have a certificate on ACLS and BCLS course. Okay, advanced cardiac life support and basic cardiac life support course. Third is the GLP and GCP certificate. Okay, so good laboratory practices and good clinical practices. Then you must have done a paper, poster or publication. Out of all these three, you must have done at least one. Okay, either you can do a paper presentation or a poster presentation or a publication. Okay, but if you want, you can do all, but you must have done at least one of this. So paper and poster, it will be done at the level of national, journal or state level conferences, and publication in the journal. Okay, then you must have completed your 3 months of residency program, DRP program, in your nearby districts. Then thesis submission is important. Thesis approval is not important for appearing the exam. You must at least submit your thesis. Okay, so if you want any details about when the BCBR exams are going on and when ACLS BLS course all over India where they are conducting. So most of the ACLS BLS course that will be conducted by your own college, but if you are not, your college is not doing, then you can go to some other colleges and there they can pursue this course. Okay, then GLP and GCP course, these you can do online also. Okay, and so this must you all should complete before appearing for the exam, and at least before studying for your exam, you must at least complete this. Okay, you must have completed your BCBR exam. You should complete your ACLS and BLS course, GLP, GCP and paper poster done. Okay, by this time, by this February, you must complete at least this and district residency program, and you should now main focus on thesis. Okay, first complete the thesis, because in the last time it will be a very much burden for you, so complete the thesis by now. Okay, now timing of the exam. You all must be having winter examination. Okay, yes, so this is important. You all be having winter examination, keep this in mind. Okay, don't worry, you have enough time. You will be having winter examination this summer. There won't be any examination for your batch. Okay, so your exam must be in October and November, as your batch have joined in the month of October, so your exam most probable it will be in November. Don't worry for that. Next, what are the exams you have to give? Okay, so first you have to give theory paper and then you have to give practical. Okay, theory it is of 400 marks and practical is of 400 marks. Total marks will be of 800, and in theory we have 4 papers. Okay, and each paper consists of 100 marks. So first paper will be basic sciences in obstetrics and gynecology, including disease of the newborn, and clinical. Second paper will be clinical obstetrics including newborn. Second, third paper will be on clinical gynecology, and fourth paper will be on recent advances in obstetrics and gynecology. So in the first paper, where you will be facing questions on both obstetrics and gynecology, and newborn one, where you common diseases of the newborn, common conditions of the newborn will be asked. Okay, and in the second paper you have to study only obstetrics. In the third paper you have to study only gynecology, and in the fourth paper again you have to study some important questions regarding the recent advances in both obstetrics and gynecology. Okay, Next, in the practical exam, you have so many stations for the exam. First, you have to take a obstetrics long case and obstetrics short case, then gynec long case and gynec short case. Then you will be facing spotters. Okay, yes, spottings will be there, and there will be viva on these cases. Okay, then followed by which will be ward rounds. Okay, yes, you will be facing ward rounds where you will be given two patients, and and you have to face ask question like a consultant. Okay, and last one is the grand viva, where there will be instruments. There can be obstetrics instrument, gynec instruments, drugs, obstetrics drugs, gynec drugs, specimen of obstetrics and gynecology, then contraception questions, and there will be maternal pelvis and fetal skulls, and all these you should be studying. Okay. Next, what you all must have this very important questions: from where to study, ma'am? Where to study? Which book should I follow? Whether I should go for the more standard books, Barrack and Novak gynecology, or I should study Williams and all that. But these books are very standard books and they are very high level books. Okay, but you have in exams you have to write questions and answers, and you have to answer at least basic. So for basic study it will be very helpful JB Sharma of obstetrics and gynecology, obstetrics books, and JB Sharma of gynecology. These two books are the Gita and Gita for you. Okay, if you study and complete these books, that will be very much helpful to you. You will answer each and every questions of your theory paper and also in the practical exams also. Then for practical I have added, if you want to study more, then you can study Submangala for obstetrics, and for gynecology practical book which I found very much useful is the Maji textbook of bedside clinics. Okay, at least you should study this much. Okay, study plan. So from now on, first the month of February, you should complete your all the above eligibility criteria like ACLS, BCLS program, then GCP course, then BCBR exam. If you are not given the BCBR exam, then complete it by this February month. Okay, then complete your thesis. Then now from the March to August you have 6 months, and you can complete your whole course in 6 months. I know you will be also doing duties. Okay, so it's very hard for achieving time and time for study, but in 6 months you can complete your whole course. For 3 months you take ops, and next 3 months you study gynec. Okay, and then we will be having another 2 months, September and October month, for our revision, which will be more than enough time for you to start by now. Okay, then how to study? First complete one chapter in 2 days, as you will be having duties, so I have prepared it like that. Okay, so try to complete at least one chapter in 2 days. Take your obstetrics book and now start any chapter you like. First start any chapter you like, and start at least you have to study half of the chapter in one day, then other half of the chapter in the other day. Okay, and this will, by this slowly your chapter will be completed. Okay, and don't forget to see the previous year questions. Okay, this will be very helpful in completing your chapter. Okay, so you are studying one chapter of the book, and you are saying that this in this chapter these questions are important, so you should also study what are the previous 10 years question of your examination. So in different states there will be having different examination, and all you are having different sets of previous 10-year question. So first take out them and arrange them, and then start your study. Okay, everything is initially difficult before they become easy. So now you will be facing slight difficulty in studying, that you have to do duty also, but then study also, and some pressure will be on you. But you know, once you make a habit of completing at least one chapter in 2 days, then there is no looking back. You can complete it in your 6 months course, and by the end of 6 months you will be feeling that this is so easy, and while doing revision you will be not facing any so much problem, and it will be very easy for you. If you find this video helpful, please like and share with your friends. Come on, start your journey exam preparations with me. Comment your other queries for the exam. In the next video we will start a chapter and complete it in 2 days with previous year questions. Okay, so take care.